In TM joint 2, we have to see the movement and applied anatomy. In movement, it's a retraction, protraction, elevation, depression, and side to side movement. Now, to understand the movement, first we see the cavity of the TM joint. In this cavity of the TM joint, divided by articular disc into the meniscomandibular and meniscotemporal compartment. Here we find the gliding type and rotation type of the movement. The gliding type of movement is done in the upper compartment, and that is a meniscotemporal compartment. And the rotatory type of the movement is done in the meniscomandibular compartment. There are two types of rotation. Means the rotation is done at the two axes. Here pink colored area showing you a horizontal axis on which the mandible is moving up and down. So this hinge-like movement over the horizontal axis gives you depression and elevation. And the second axis is vertical axis on which you will find the side-to-side movement. Now we start the movement of mandible. In the resting position, normally the maxillary teeth remain slightly outward as compared to mandibular teeth. You can see here the mandibular teeth are slightly inward, and there is a space remains between the maxillary teeth and mandibular teeth. It's around 2 to 4 mm. So with this space, the mandible is in the resting position. Now I am taking this mandibular teeth forward. You can see here this two teeth, mandibular teeth and maxillary teeth, come in line with each other. And this is called occlusal position, the most stable position of the maxillary teeth. Whenever we are chewing, the mandibular teeth and maxillary teeth come in line with each other, with mandibular teeth gives force towards the maxillary teeth for the chewing process. And this force is up to the 150 to 300 pound. Now we give the different type of movements with the mandibular and the first movement is now first we take it in the resting position. This is the resting position of the mandible. If I take my mandible forward, so here I am taking my mandible forward, this movement is called protraction. The muscles taking part in protraction are lateral and medial pterygoid. Both sides of lateral and medial pterygoid are taking part in for the protraction of the mandible. After the protraction during chewing process, again I am taking my mandible backward. Either it is in the resting position or there is a further taken backward of the mandible. When it's a resting position, there is a normal retraction of the mandible. If I take further backward mandible, it's a forceful retraction of the mandible. The muscle for the normal retractions are the posterior fiber of temporalis, and the muscle for the forceful retractions are the deep fiber and middle fiber of the masseter and digastric muscles. Now, whenever chewing process is done, I have to open my mouth for taking the food inside. That movement is called depression. In the depression, in the joint cavity, we find three phases of the movement, and they are: there is a rotation, again there is a gliding, and number 3, that is a rotation. As we know, the rotation is done in the lower compartment, gliding is done in the upper compartment of the joint. The rotation is always forward and downward, and the gliding is done over the horizontal, it's sticking the whole axis forward. That we will learn in a detail. For that, we see the joint cavity again. In this joint cavity, we will see the articular capsule. Below that, there is a head of mandible, gives you the movement. This head of mandible from figure 1 going to figure 2 will showing you the forward and downward rotation of the head of mandible. The head of mandible is only going forward and downward. So there is only movement of the head of mandible, that is rotation at the horizontal axis. The axis is fixed at its place. Now in the figure 3, the gliding is already done. That is a phase 2 activity. With this gliding, axis glides forward, along with that head of mandible and articular disc also glide forward. In the phase 3, again you will find there is a forward and downward rotation of the mandible. This head of mandible reach at the summit of articular tubercle. So there is a maximum rotation is done at this level. Now here there is a ratio. If I open my mouth up to the 40 millimeter, that is a 4 centimeter, my rotation gives it 25 millimeter, while the gliding movement will give it up to the 15 millimeter. I can open my mouth up maximum up to 50 millimeter, that is a 5 centimeter. But again it is an average ratio, variable with person to person. Muscle related to depression there are two type of movement. So there are two sides of muscle. For the gliding type of movement, always there is a lateral pterygoid. For the rotatory movements, they are geniohyoid, mylohyoid and digastric. These are the part of suprahyoid muscle. At the same time, this muscle, when they are doing movement, infrahyoid muscle is fixing the hyoid bone. Now we come to the elevation. In elevation also we find the same type of movement reverse, but it is in a reverse form. Like we will get the upward and backward rotation, gliding backward in the upper compartment. But the muscles acting are the masseters, temporalis, medial pterygoid. Now we come to the side to side movement. Whenever we are chewing in mouth, we get the side to side movement. Here lateral and medial pterygoid muscle of one side, then after the other side. So they are acting alternately. Here both type of movement we can find. They are rotatory and gliding movement. Here same side of mandibular head rotate in the lower compartment at the vertical axis and glide in the upper compartment. The same thing happen with the other side of head. The axis, vertical axis, as I had told you previously, it passes through the opposite head, posterior border of ramus of mandible. Now we come to the applied of this jaw joint. Dislocation of the mandible is always in a one direction, and that is forward. Whenever there is a sudden spasm of lateral pterygoid muscle occur, that is sudden wide opening of mouth. Normally this wide opening we are doing only in the yawning.